This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D. or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome. It's another edition of the Dr. Molly Show,
Hi,
otherwise known as Health Watch, every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. We talk on this show about the who, what, when, where, why, and how of Innovative Medical Associates and how they can potentially help you or anyone you know improve your overall quality of life. That is our mission statement, and we are dedicated to that here on the program. 855-839-1210 is our number here in the studio, 855-839-1210. And as always, Dr. Molly, we welcome you, and we look forward to another show where you educate us.
Well, I don't know about most of your listeners are pretty educated. You know what, John? I'm happy to be here because everybody in my staff took bets that I wasn't going to be here, right?
That's right.
But
right.
see, I listen to my own advice, all
right?
So, yes, I have a cold, folks, so if I sound a little bit nasally, forgive me, but you know, John saw me on Thursday.
Yeah, and I said, I don't know.
I said, but, you know, I was already taking treatment. Listen, I believe in quality of life. I can't cure the cold. I can't cure the common cold.
Right.
So when you talk about vitamin C, let's clear that up. It doesn't cure the common cold, but with what we do with the vitamin C, we can shorten it and make it a little more palatable for you to deal with when you got it. So
that's right.
I'm living proof today that I made it.
That's
okay?
right.
Thank you, John.
and that goes to show you what the power of hydration is.
Oh, my goodness, yes. And what we do with the hydration.
And speaking of what you do, what do you do, by the way?
Yes. Well, as you know, John, we're a group of like-minded healthcare providers, two physicians. I have wonderful medical directors, and myself and my wonderful nurses. And what we have, we all work out of my primary care facility. However, it is really our philosophy that makes us different than most primary care facilities. We can order all the radiology you need. We can order blood work. In fact, we have a blood draw station right in the clinic. We can also take care of any of your outpatient. If you need physical therapy, we can send you for PT. So we can do anything that a normal primary care doc, including writing prescriptions for you. However, the philosophy is we want to use the least amount of the pharmaceutical necessary to correct your challenge, keep you safe, and improve your quality of life by reducing the side effects of the pharmaceuticals itself.
And you do this with nutraceuticals?
Right, with the kind
for
of
the
stuff
most part?
You might see in a health food store. You go in, you get some vitamins, you get some minerals, you look for amino acids, you look for herbal products,
yes.
Right? So the question is, we use hydration, though, as the delivery system. Why do we use the hydration? A more direct delivery system. We're able to use a therapeutic amount in order to effectuate the change and to keep you safe through this process because we are a medical hydration clinic.
We do have a caller, Kirk?
Yeah. Okay.
Yeah, okay. We have a caller, and who is it, Joe or John? It's Joe. Joe?
Mm-hmm.
Joe?
Hi, Joe.
Good morning. Welcome to
Hi,
Health Watch.
Dr. Molly. Good morning, guys.
Hi.
I got
Hi,
some
guys.
news for you. John, I tried to call you, but I lost your number, so I asked after if we can get in touch because I got some more news on this cancer. You're not going to like it, but you're tough and you're pretty good. I went to the Dana-Farber here in Boston,
Yes.
and as soon as I mentioned medical hydration and complementary medicine, they poo-pooed it.
Yes. Well,
that's normal.
Well, look, you know, Joe, you hear me say this time and time again. I don't tell people to get rid of their conventional medicine.
That's right, but I don't want radiation because it does damage the prostate and damages the stress.
We understand that you don't want radiation, but, you know, the bottom line is I really would need to see the actual. I would like to see all of your testing, all of the radiology you've already had done, the biopsies, if you get some of that, more of that information to me, then maybe I can give you some advice even while you're in Boston. The point is, though, I would tell you that don't poo-poo conventional, okay?
No.
But I will tell you this. One thing I'm going to say that's in your favor. For the most part, funeral directors see more deaths related to this, meaning further along in our life as age-related, right, than other people. So please, don't give up. Know that there are things to help support you through things, including support you through radiation. I get it.
Yeah.
I truly get it.
Well,
And I have patients
did I send you the? I did send you the biopsy. Did I send you
Yes.
the? What other tests do you need? I don't remember.
I would
what.
like to hear what is the scheduling for the radiation. What did they say anything about chemotherapeutics, especially when you went to Dana-Farber? Because I bet you they have a different type of protocol together than anywhere else. It would be
The
interesting
only
to
thing
see.
they said is a radiation. You would have 5 treatments, and it would ablate the prostate, and then it
Right.
said something about hormone therapy, and that's worse of the side effects. I just wish we could make arrangements. I could at least try see you. I don't know how much this costs for like 15 treatments. Is there any way I could find out and at least. Even if it doesn't work, at least I could try it,
Yeah.
I'd rather do that than because the radiation
I
will
hear
ruin.
I hear you about your problem with radiation, but you know what, Joe? One of the things you can do is you don't have to do all of the 5 treatments. You can start, see how well you do, see if that makes a difference in the tumor. Okay, all right, okay.
Well, he told me you have to do all the 5 treatments. You could stop, but he would recommend all the 5 treatments.
I know that, but you are allowed to stop. You know that.
Yeah, but he
anyway,
said it won't get rid of the cancer. He said it won't get rid of the cancer unless you do them all. I don't know. This is the way they are.
I understand. I truly do, and I hear your frustration, my friend. All right.
So
God bless you. You're
Joe,
on our,
Joe,
you're on our prayer list.
I'll email you during the week. I promise. I'll email you.
Please, John.
And
please.
I'll just kind of summarize this whole thing. Okay.
Thank you.
Well, can we
God bless
talk?
you, Joe.
I'll give him my number. Can you call
Okay.
me after this?
Yeah.
We can talk.
Yes. Okay.
Thank you.
Thanks for
Thank
the
you,
call,
Joe.
Thanks for the
God
call,
bless
Joe.
you. God bless you.
Thanks. God bless.
Thank you, honey.
855-839-1210. That's our number here in the studio. Really, the thing here is, if he gets the radiation, you can probably help him with some side effects.
Yes.
That's
yes.
what you're trying to.
And also, we'd see where he is, right? Bottom line.
We have Neil, and we're going to take him after the break, Kirk. We're going to break right here, and then we'll take Neil and maybe you at 855-839-1210. The program is Health Watch every Sunday, 8 till 9, here to the live version on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the executive director, the PhD doctor, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We'll talk more about the who, what, when, where, why, and how of Innovative Medical Associates. We'll talk to Neil. Maybe we'll talk to you. Hey, we got a whole bunch of stuff to do. We will come back. Dr. Molly and I will return after these words. We are back here on Health Watch. And as always, operators standing by right now at Innovative Medical Associates. And the number, 856-489-0505. I say that number in my sleep, believe it or not. 856-489-0505. They're standing by right now, and they will be happy to take your call. And really what you want to do when you call is book the initial consultation with Dr. Molly. It is complimentary, but you really do learn a lot in that session, and she'll give you all the time you need, and certainly you will learn a lot, and that is going to help you make a decision as to whether you want to move forward. 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. Our program is Health Watch. This is the live version, 8 till 9 every Sunday morning here on Talk Radio 1210 WPHT. Let's talk to Neil in Riverside, New Jersey. Neil, good morning. Welcome to Health Watch.
Hi, Neil. How are you?
Hi, I'm doing fine. I have a question about cholesterol gummies.
Okay.
It's 500 milligrams. It says high dose plant status and stellolus.
Yes, yes.
Um,
Okay. You got this at the health food store, right, my friend?
Yes.
Tell me. Yes, okay. So tell me what your numbers are, your cholesterol numbers.
Um,
Well, they're
103 and 173.
okay. 173 is the bad cholesterol. Is that what you're telling me?
Yes.
Okay. So, are you how much success are you having with the product that you're using?
Well, right now I'm using avastatin. 20
Along
milligrams.
with this, yeah, along with the product, right? Okay. Are you using the?
I'm just interested in if the cholesterol gummies are the same as the rice yeast that's in LDL-Q10.
Okay. Listen to me now. The product that you just mentioned, is that a product from the company that's on right before me? Where did you get that product, sir?
The gummy one? The gummy
Yeah.
one's on Amazon.com.
Okay, what about the other one? The one you just talked to about the CoQ10 and the red yeast rice?
That one is on the Rescue.
That's why I'm
Yeah.
asking. Yes, I know the product. That product is pretty darn good, okay? And I'm telling you, listen, I don't have to promote that because there's no interaction between me and the people before, okay? But it is it's good. Now, if you were my patient, I'd be using something called chelation therapy for this because chelation we've used in terms of EDTA. We've managed the calcium that causes part of this cholesterol issue. Very interesting. Now, it seems to me that your doctor probably ran a very specific test for you with those numbers. I bet he ran the Cleveland Clinic test. I'm not sure, but I would love to see it. You should come in for the free consultation because I'm fairly close to you, because I think we could help you in addition and also guide you as to what supplements you might be taking along with what you're doing right now. Obviously, you want to get off of the statin, correct? Is that what your goal is, sir?
Yes.
Good.
I'm also looking at another thing. It's called red yeast rice and
Yes.
CoQ10.
Yes,
Is that the same thing?
Of course. Of course you're looking at that, but you want to be careful because red yeast rice has a propensity to work on the liver as well, but you have to use it properly. Listen, come in and see me, Neil. Honestly, the consult's free. The consult's free, and in 15 minutes I may be able to sort some of this out for you. Because it seems to me that you're trying a lot of things. And you know what I found? Most patients who come into me and they have a multitude of nutraceuticals as well as drugs tend to overlap some of those. So
That's
maybe
right.
you're getting doubles or whatever. Come on in. I promise you I won't bite, and nobody puts a ring around your collar to make you sit in my chair, okay? All right? You seem like a really nice guy. God bless.
Thanks for the call, Neil. We appreciate it. We appreciate it.
Okay.
Thank you.
Thank you. That, I think he could see he's a little intimidated, I think, to come in. And frankly, John, how I am.
Yes.
In fact, people insult me in the consult,
Yes,
and I still talk to them, right?
Right.
So listen, I really mean that I will try, because again, when you start spreading around what you're doing, you may have overlap, you may have things that are contraindicated together. It would be a good thing to get together, and I could tell he really is anxious to get off of the statin, and I wouldn't advise that so quickly, right?
Right.
We do it in a way that keeps you safe. That's
I know
the way.
you've had a lot of experience with this
Oh,
kind
my
of a
goodness,
situation.
27 years
Yes.
with this one, right?
Yeah.
27 years, but I'd like to see the data, too.
Yes, yes.
What is the underlying issue of that 171?
And he got the red yeast rice.
Yeah,
and
sure.
That you need to be a little careful
Yeah, of
with
course
that.
you do.
Yeah.
You know how we are. We use certain brands, but again, don't mix up your stuff, folks, because in some cases you can do yourself more damage.
855-839-1210. That's our number here in the studio. We didn't finish the beginning segment.
Okay, the overview. So
we'll,
anyway.
we'll kind of the number one question that people ask you
Mm-hmm.
in a consultation is, does this work?
Yeah, or they get very upset if I say it doesn't cure their particular challenge. Well, I would say that conventionally, for example, I think cancer is a good one. Many times there are a couple of blood dyscrasias, a couple of cancers that the oncologist will say you absolutely are cured. Most of the time what they say is you're cancer free, right, John? Have you heard that?
Yes.
You're cancer free. You had cancer, so you know
Yes,
that's true.
yeah.
So, and I can relate to that as well. So you're cancer free. I would say that what we can do for you is maintain your quality of life, safely get you through whatever conventional treatment you want to do. And if you don't want to do conventional treatments, and by the way, I want to send a shout out to my girl Pam, who did no conventional treatments. We were at their wonderful restaurant this week for my holiday luncheon for my staff, and she looks robust. But again, what does she do? She manages what she takes in terms of her diet. She also manages the supplements that she's taking, and we've helped her with that. And she never misses a week in our chair.
That's right. And she's been very diligent from the start.
Right, about coming in. And indeed, that's the issue, John. If people will listen to me, I know that we can help them through whatever the challenge and journey is.
I remember what she said to the oncologist. She said, "What part of this treatment is not toxic?"
And that was right. That's right. And she tells everybody that story, and it's a great story because it's true. And the thing I want to say to you is we don't discourage you from doing a chemotherapy or doing a radiation. You could hear the last call. But can we mitigate some of those side effects? We can. And indeed, I can say we can mitigate your side effects with that and maybe, just maybe, enhance the treatments that you're doing. So this is what I want to say.
The other question that I know you get all the time is, well, how many treatments do I have to come in for?
John, listen, you're a lifer. You've been with me. Pam's a lifer, right?
That's
it
right.
really depends on what's going on. But people tend to see changes in at least 10 treatments, which can be as little as 5 weeks or 10 weeks, depending on the protocol that the patient goes through. So there's a lot of ways we can handle this. And also, listen, a lot depends on what you do. Do you listen? Do you listen when we talk about the diet? Do you listen when you talk about, the lifestyle changes? I mean, obviously, if you're going to be an avid smoker, it's going to take a little while if you have a lung disease,
Yes,
okay?
yes.
So, we got to be smart about these things. And I know, though, overall, we do a heck of a job for patients.
And back to how many treatments.
Yes.
Like if you're just moderately high cholesterol,
Yeah,
what could you expect?
20 treatments, generally, we have it really under control.
Yes.
And we can maintain that. And you go down to maybe once a month, once every 3 weeks. It's really going to depend, again, on your lifestyle. Look, if you're going to eat a steak 5 nights a week, right, and a ribeye at that, you're going to be in a little more
right.
often,
That's
okay? If you cut it down to filet, maybe you're not going to be in quite as often. But the point is, listen, patients have to do their homework too, but we help you do that. We definitely make a difference in your quality of life.
And when it comes to like a case with Joe,
Oh, my goodness.
that's a little longer, you figure?
Oh, my
your
goodness. He's going to be a lifer. That's the point. That's why I would love to find him somebody up there, but it is very difficult because there's not a lot of people who truly take the time we do. My medical staff and myself and my nursing staff take the time to really get the patient and figure out what it is they need to do.
And you do take the time. I can attest to that.
You can be sure of that. I came in on a Friday, even though I had other commitments, as you know. I said, that's it. My patient needs me.
What are some of the people always like to know because they go into the health food store and they ask.
Gosh.
So what are some of the main things that you use?
Well, we use things like vitamin C. We use anti-inflammatories. We use amino acids, neuroamino acids for people that are dealing with all kinds of conditions. It's quite interesting. I mean, there are just so many new things out here. And the thing is, John, I want to tell people it's our delivery system. It's the system, the way I manage these particular products for a particular patient and protocol. That's what makes the difference in our outcomes. I believe that with all my heart because we have the proof.
We are at the halfway point of the show already. Time flies. I always say that. Time flies when you're having fun. It is Health Watch every Sunday, 8 till 9, Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. 855-839-1210 is our number here in the studio. 855-839-1210. Good time for you to jump in here if you have a question or a medical challenge you want to run by Dr. Molly. We've got some open lines. 855-839-1210. We are both coming back. Dr. Molly and I return after these words. We are back here on Health Watch. And again, operators standing by right now at Innovative Medical Associates. And they are welcoming your call at 856-489-0505. Again, 856-489-0505. You know the drill when you call. Very simple. All you do is make the appointment to sit with Dr. Molly and go over your situation, and she can potentially help you if you come to an agreement there. But it's really informative, and that's what you want. 856-489-0505 is the number. And you check out the website because you'll find a lot of good information on that as well. InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com. That's the website. Our show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We're going to the phones. We're going to talk to Julia in Abington. Hi, Julia. Welcome to Health Watch.
Hi, Julia.
Hi, good morning, guys. I just have a quick comment. Dr. Molly, I know you saw the recent article that came out about 3 weekly doses of IV vitamin C can double your survival of pancreatic cancer. So when I heard it, I'm like, Dr. Molly was right.
Oh, thank you. Yeah, you know what? I will tell you, I think one of the things we're going to talk about today is lung condition. But I'll tell you what, there are changes in conventional medicine saying that medical hydration plays a part. You know, one of the things I was going to mention, too, is in POTS, diagnosis, right? If without the proper hydration. Now, all of this being said, do you know we're all on allocation, you know? Are you in the healthcare business? Hopefully you are. Yeah, you're a nurse, right? Did I remember?
Yes.
Right. So you know we're all on allocation, right? I got to tell you, I thank God every day for the fact that we are a licensed medical facility, because can you imagine right now getting all of the IV fluids we need? It's just been incredulous. You know that. Oh, my God. In fact, 2 of my nurses, this is an interesting thing, folks. You have to understand your nurses out there and how wonderful they are. You know, they're doing the home care. They've seen a cutback in taking new patients. Isn't this unbelievable? I mean, it's unreal to me that we're doing this, right? Don't you think? I mean, it's crazy. Yeah. So I don't know. I'm hoping that whatever happens in the new year, things lighten up and we can all get as many of these things we need to help our patients, no matter what side of the fence we're on. God bless you. God bless you, Julia.
No, but like I said, I'm glad that the traditional physicians are now starting to realize that these can, unconventional, treatments work, But thank you.
Thank you.
Thank you, Julia.
And
Appreciate
I remember
the call.
Julia. That's why I said it. I know, and she sounds like she's an intelligent. Most of the nurses I meet are very much understanding that what we do is complementary. It is integrated into conventional care. And that's why I get such fine RN nurses. You know, my nurses are usually have other jobs with very big institutions, but they love what we do because they take what we do.
Yes.
That's the thing. That's the beauty of this. So
what did you mean by, you said we're on allocation?
It means that the government has had, because of the problems with the hurricanes and the floodings and all this, the people who manufacture the carrier solutions like the saline and things like that, the bags.
The things that you use.
Yeah, right. They have to put us on allocation, meaning they allocate it in order of a certain order. So sometimes certain types of facilities aren't getting this. Like I would say a lot of these places that are spa-like might be having a little problem. And again, I'm paying through the nose. And if you hear Julia, my nurses are telling me on the home care visits also, there's been some challenges. They can't take some new patients because of it. And these are big institutions. So believe me, I thank God every day for what I have in stock, and I'll pay because my patients need to have it. So if it changes, my outcome, what's left in terms of what, quote unquote, if they call it profit, whatever the heck you want to call it, fine. Let's not worry about that. Let's worry that we have to make a living, right? But let's worry about making sure our patients are taken care of too.
Okay, 855-839-1210. That's our number here in the studio. Dr. Molly always educates us, and today she will continue that education by teaching us a new word, bronchiectasis.
Well, yeah, bronchiectasis, yes. Okay.
I hope I pronounced it right.
I think it's close enough.
Yeah, okay.
Bronchiectasis.
I practiced before the show.
Bronchiectasis. Me too. Reading it and talking about it, but I've seen it. I actually have a patient. You remember a few weeks ago I told you about the patient I had who had COPD.
Yes.
Well, she also had bronchiectasis. So sometimes that goes hand in hand. But bronchiectasis includes a history of severe lung infections such as pneumonia, tuberculosis, but in addition, genetic disorders, which was interesting because this patient comes from a group where they have a lot of genetic dysregulations. In fact, one of the things that struck my mind when she came was she had a granddaughter who had cystic fibrosis. So you can imagine there is a lung relationship.
Yes.
And interestingly enough, not just an immune function problem, but the reason why I'm talking about this today is that there are diagnostic pathways for this. So, of course, first you have to have the diagnosis of bronchiectasis. Okay, so it's done by history and examination. You do imaging. You want to look at the lungs, that kind of thing. You want to do screening tests in the blood. And interesting, I ran a screening test for the cystic fibrosis gene as well as something else that came up, right? And interesting, she had one portion. She didn't have a full genetic component of that, but she had the carrier gene, okay? So obviously that may have had an effect on the inflammation in her lungs, okay? Also had to do microbiology, in that we had to test the sputum cultures, etc. So bronchiectasis is a very terrible condition because it really has persistent cough and lots of producing mucus, shortness of breath, wheezing, chest pain comes about, coughing up some blood, fatigue, extreme fatigue. Do you remember that patient? Didn't she look like a little waif? She was bad. When she got to me, she was bad, okay? Frequent lung infections, which she had. And during that period of time, I was also treating a patient who also had a lung infection called Q fever in his lungs, right? If you remember. So I was inundated at this particular time. By the way, they were both doing well. They're both back in their home state, and we're doing some follow-up with them. But the reason why I'm talking about that is because just like Julia was talking about, that conventional medicine is coming around on this particular condition. Now, my aunt had this condition 23 years ago, when it was one of the first times that we treated this. And we never talked about any natural treatments for this. We started doing it in our facility because my medical directors, even today, are very brave and know the interaction of certain nutraceuticals and what they can do for the lungs. So we started to work on this with my own aunt, but her pulmonologist at the time didn't know a thing about this. But what's come full circle now is that they're realizing that if you look at this as a chronic inflammation type of condition, you know there's an autoimmune issue involved or an immune issue involved, right?
Yes.
Think about it. If we're looking at inflammation, what do we know works on inflammation, John? One of the first things you know.
Vitamin C.
Right. Vitamin C is one of the things we use.
Is this in any way related to genetics?
Yes. The cystic fibrosis condition, certain other problems that can cause this in terms of genetics, and more and more of these are forthcoming right now. And, but in addition, we must look at what do we do to support a patient through this. And by the way, we have one of the largest lung centers in the country right here in Philadelphia,
yes,
as you know. And my patient, actually, I got and most of my patients, I get them to see pulmonologist in this facility because this is nothing to fool around with. this condition. But what do we use? We use things like NAC. We can use alpha lipoic acid. We use an extract from pepper. We use, of course, vitamin C. I also do something with the physiological re-regulating homeopathics that I have in stock. You remember me talking about that. If this is on other conditions, and sometime again after the new year I'll go through this again, using low-dose homeopathic cytokines. Remember me talking about cytokines?
Yes, I do.
A small amount of them are necessary to fill receptors, and they'll occupy the receptors to get a large response, an anti-inflammatory response. So you use anti-inflammatory cytokines. And what you're doing is you're looking at these pathways that affect the lungs. So that's some of the things I use. In addition, go ahead.
Stop right there. We'll pick that up after the break. We are coming up on our final break of the morning. 855-839-1210 is our number here in the studio. We're going to talk to Joe from Germantown.
Oh, my God.
The mayor of Germantown after the break, and maybe we'll talk to you as well. And we'll wrap up this discussion of bronchiectasis.
Yes.
I said it right.
You did.
855-839-1210 is our number here in the studio. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We are both returning with more of today's Health Watch after these words. We are back here on Health Watch, and as always, operators standing by right now at 856-489-0505. Now, I'll let you in on a little secret. The operators don't go home at 9 o'clock when we do. They stay there, and they're there all day, even through the Eagles game. I mean, it's just they're dedicated. 856-489-0505. That's the number. Again, 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you miss any of today's show or if you just want to hear it again, our Health Watch replay this afternoon from 4 until 5, right here on Talk Radio 1210 WPHT. Health Watch is the show, and we are going to the phones right now and talking to the mayor of Germantown. Here's Joe.
Hey, Joe.
Happy holidays to you, John, Dr. Molly.
Thank you.
And happy holidays to your wonderful producer, Kirk. Happy holidays to all y'all.
Thank you.
You're welcome. You know, it's so ironic, Dr. Molly, you and John talking about pulmonary. I was just at the University of Pennsylvania Hospital, which is considered, I guess, one of the top hospitals in the country.
Sure.
I was just there last week for some tests for pulmonary, and it went well.
Good. Thank God.
Good.
Thank God. The doctor treated me so nice. She was an Indian doctor. She was so sweet and stuff, man. She spoiled me to the point I didn't even want to leave. She treated me so nice. I didn't really want to go home. I wanted to stay. but anyway, it was so nice and stuff. And I want to thank you too, Dr. Mike, for having that. After you had the nurse on a few minutes ago, that was about since she was okay with integrative medicine and everything. Is that correct?
Yes. Yes.
It makes me feel so good, Dr. Molly and John, when I heard nurses, as well as doctors, when they open-minded, when they willing to, when they enter, like, for example, like I have a friend of mine, he is a holistic doctor. Now, he takes blood pressure medicine, but his doctor is open to having, alternative treatments to treat his high blood pressure.
Sure.
When doctors or health professionals are so close-minded, they just shut everything down for traditional pharmaceutical. When people like that, I run from people like that. But when I see people like yourself, Dr. Molly, and others that think with open mind, them the kind of health people I have faith in and I love and I trust. And that's the bottom line, Dr. Molly.
God bless you. God bless you.
Okay.
God bless you, Joe.
Yes.
Hey, you know what? Thank you. Thank you.
You too.
Joe
And Merry Christmas if we don't talk to you, Joe.
Yeah, you know what? Joe brings up a good point. I went in on Friday because I needed to talk to an infectious disease guy that I know was calling me right after the patient was in his office. So I wanted to do a conference call with my medical director, myself, and the infectious disease guy. So this is the kind of things that we want to do. Now, again, my medical director and I, we chatted about the call afterwards, and we believe we can help this young man using both conventional antibiotics and many of the things we use in addition to maintain the inflammation process, so to help keep it at bay. So, I mean, this is how you work hand in hand. All you need to do is communicate, and they have to have an open mind.
Yes.
So, getting back to our
Bronchiectasis.
Yes, I just want to say the curcumin, the D-ribose are things that we use. Also, I want to say there's ginger, licorice root, olive leaf extract, garlic. So, and they're just some of it. Glutathione, as you've heard me. But I want to go back to what I was saying about something starts this inflammation, like everything else, right? And then what happens is the body goes haywire. This particular patient that I'm talking about, she used to do furniture finishing. So she had the genetics that could make her have a problem, not full. She doesn't have cystic fibrosis, right? But she has a one polymorphism that could contribute to a lung problem. Now she's out there doing furnishing repolishing without using a mask.
Ooh.
So don't you think she brought this lung inflammation
Absolutely.
onto herself? She didn't realize it, right? She didn't realize it. And in addition, she has a genetic disposition on how she can utilize B vitamins, which are extremely important for lung health. B1, 12, 2, 3, 5, 6, and additional. So, you know, when I look at this, I have to say, okay, what do we need to put into her particular hydration that was going to help her get through this, as well as getting her over to the pulmonology people who are in charge of this and managing the infection with antibiotics, etc.
Can she still do her job?
No. She better run from that job. In fact, she shouldn't. She keeps going into the shop because it's a family business, but I think her sons have pretty much told her, stop. So,
I mean, can you imagine?
plus,
Have
she's
you
up
ever
there
smelled
in
that?
age. She's up there in age,
Yeah.
and you saw her. And you know what else? When they have this, they also have a whole lot of problems, I mean, with their overall immune system because they simply can't eat enough protein. Her proteins were low. Her liver enzymes were a problem. I mean, there were many things you need to look at, and they were the things that we needed to address in the medical hydration.
We are going to give a few updates on patients.
Yeah.
Joan?
Yeah, Joan. Everybody knows Joan is my cancer patient. She's a wonderful woman. She got radiation therapy, and actually her interventional radiologist does speak to my medical director and myself. And she's doing very, very well. She's finished her radiation treatments. We're keeping her going. She had a rough bout there through the last radiation treatment, but she's really doing well. She's not having the nausea associated with it. We're keeping that at bay. And she said, Molly, I got to tell you, the fatigue level is infinitely better than when I ended and that first 2 weeks. So this tells you, but she doesn't miss a treatment.
And that's a key.
And she also follows what we ask her to take outside the clinic.
And then you have a POTS case.
Yes,
Julie.
very, very hard case. This is a young woman. She's in her 30s. She's a librarian. I think we have a bona fide diagnosis. I'm sending her to a specialist in POTS who's a cardiologist. I will know more directly. But in the meantime, hydration is very, very important for POTS patients because they can't hold the salt. They can't hold their fluids, which allows them to have a multitude of other challenges, John. So she comes in for a high dose. And on the allocations right now, that's been very difficult.
And she better not miss a treatment because it sounds like it's very, very important.
It is. It's extremely important, and it will definitely cause a problem.
And then you had an accident case, and this
I
was
have
pretty
an accident
serious.
case, yeah. This was a referral from a neurosurgeon who's a friend of the clinic and also was a patient of the clinic. And this young woman is a young woman. She's got multitude of pain. We've been holding off the pain by using, again, physiological re-regulating medicine, homeopathic, plus certain anti-inflammatories and natural pain substances. However, I also have made an appointment for her to go to a pain specialist who is also a friend of the clinic and agrees with integrative philosophy. So, and is also a good friend of Dr. Pat's, who's was an anesthesiologist.
So, and is also the medical director.
Oh yeah, she's the best. Yes.
And with this accident case, what do you figure?
Well, I don't know. I think we have to get the report from our good friend who's the pain management guy who's also an anesthesiologist. So we're gonna do that. As you know, Pat isn't doing anesthesia anymore because of her MS, but she does great. She's still great in that clinic.
That's right.
And that's what counts. I mean, she's really she said this saved her life.
And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now at Innovative Medical Associates, and they will be there well after we leave you at 9 o'clock. 856-489-0505. That's 856-489-0505. Check out the website, innovativemedicalassociates.com. innovativemedicalassociates.com. That's the website. And don't forget also, you can listen to us again, 4 to 5 this afternoon, the Health Watch replay, right here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, also known as Linda the Eskimo, our nursing staff, Lana, Donna, Jess, and Jim, and there's Joanne, Delightful D, Fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thanks for listening. We'll talk to you next Sunday, Health Watch, 8 till 9 here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.